The nationwide rankings of Department of Veterans Affairs nursing homes around 133 ranks upon internal quality ratings. Its results obtained and shared by the Boston Globe. Veterans Affairs nursing home in Leon ranked near the bottom 105th out of 133 homes. The information collected by the government represents the Leon facility got 470 points in the 12 months ending December 31st out of 1,100 points. There are 11 standards that affected the heat and quality for residents. Considering similar figures compared with average for all VA nursing homes and private nursing homes across the nation. The largest VA with 250 beds, known as Community Living Center, attained 1 star out of 5 by providing health care to the patients with serious mental illness, post-traumatic stress disorder, substance use disorders, spinal cord injuries, and hospice and palliative care need. There are good ratings in some criteria compared to private nursing homes. No one at Leon physically restrained on a daily basis in 2017, according to the data. That resulted in the facilities getting 100 of its 470 points. Also, the rate of residents with urinary tract infections, a sign of dehydration or poor hygiene that could lead to more serious health problems, was lower at Leon than both the VA average and the private nursing home average. But in other areas, including how many residents treated with antipsychotic drugs, the Leon facility rated worse than both the VA and private averages. Nationwide, the ratings paint a picture of government nursing homes that rate worse than their private sector counterparts in 9 of the 11 criteria. Under federal regulations, private nursing homes must disclose voluminous data about the care they provide, which is available on a government website to families seeking a place for an elderly loved one. On 5 criteria, Leon did better than the VA average, but worse than the national average. The facility received 50 points in the ratings. For example, for fewer short-term patients, those present for fewer than 90 days, with new or worsening pressure ulcers on their skin, prevented by repositioning or cushioning. But on 3 criteria, Leon performed worse than both the Veterans Affairs nursing home and the national averages. There were more long-term and short-term patients than both averages receiving antipsychotic drugs. The Food and Drug Administration has said are associated with an increased risk of death in elderly patients with dementia. At Leon, the rate of long-term residents on the drugs was 27.02, compared with an average of 20.89 at all VA homes and 15.48 at private nursing homes nationwide. Bhatnagar said the VA has reviewed all veterans on antipsychotics for the clinical appropriateness, and a gradual dose reduction program was instituted for those who did not meet the clinical indications. There also were more long-term residents at Leon than the national averages. They have marked decrease in their ability to perform basic functions such as bathing and eating. The rate was 19.58 at Leon, compared with 16.7 for the VA and 14.99 at private homes. We have instituted protocols to promptly address veteran functioning upon admission and throughout their stay, Bhatnagar said. Our restorative nursing team have implemented champions on each unit to continuously educate and coach staff on strategies to prevent functional decline.